Where's Michelle? Okay. Good morning, everybody. Good afternoon. I apologize we're a little late. Of course, it's construction season in Syracuse, in Onondaga County, so didn't get here. And I want to really thank the superintendent for inviting us here today to talk about a quick briefing on where we are with COVID, then to talk about our mental health initiatives and the partnership we have here with the Marcellus School District and this beautiful campus. With me is our county legislator for the town of Marcellus and the 6th Legislative District, Julie Abbott-Keenan, as well. So thanks, Julie, for being here. Hospitalizations, 96, with 21 residents in the ICU. Out of the 21, 19 of those in the ICU were unvaccinated. So certainly we can continue to see some pressure on the hospitals now. The pressure isn't even so much COVID numbers. If you recall, back in the second wave of COVID, we would have COVID-related residents in the hospital of over 300, but due to staffing issues and due to the fact that we're the infrastructure for not just Onondaga County, but all of Central New York, parts of Northern New York, our hospitals are busy. So we continue to monitor that situation on a daily basis and communicate. Active cases, 991. New cases today, 100. About 26% of those are household contacts, 30% are higher ed, and then you have travel-related cases of about 7%. One thing we have seen is cases are flattening out. We get some projections from the CDC that Dr. Gupta shared with me this morning, and it does look like the projections from the CDC for the next 3 weeks will essentially be in the range we are today. So we'll see high case days, typically on Fridays and Saturdays. That's just the way the testing reports. And then yesterday was a good case day. Today's not a bad case day. But it looks like the flattening of the wave here is coming, and can we bend the wave here and get on the other side of it. 52% of the cases today were vaccinated, and that number is going to be between 45 and 50 now, especially since we have more of the community getting vaccinated themselves. Just for clarification, though, we'll always report out the percentage of positives. That's 52% of positives. Some suggest that 52% of the total vaccinated population, when I say this, has had COVID, and that is absolutely not the case. It's under 1%. Booster plan. So we're waiting anxiously to see if the Pfizer vaccine, for those who have had their vaccine for 8 months, that's our understanding of what this may look like. If we get the green light, we'll start implementing the plan. But the points of distribution for boosters will look like this. We're working with the large doctors' offices and physicians. We will want that to be a major point of distribution. We will distribute vaccine as needed there. And as Dr. Gupta and her team have talked to everybody, and they're working through which offices are going to participate. And as soon as we know that, we will make that public so that people can know if their doctor's participating, and if not, then they can go and save themselves some time and go to other points of distribution. Our pharmacies in the area will likely all participate in the booster shot program. And we will have a county-sponsored vaccination site in partnership with Kinney Drugs. We'll coordinate large vaccinating capacity either at the War Memorial or on center, depending on a couple of different variables. But certainly we'll have a larger clinic available to the public, and we will again do online registration through our website and or the Kinney site as well. We will turn that lever on if next Monday afternoon we hear, for example, we'll look to have our first mass vaccination clinic towards the end of the week. Regarding the fairgrounds, we're communicating with the state to see if it's necessary. Remember, we're talking about people who receive the Pfizer vaccine only, and who will likely have received it 8 months ago. So you're going to have a more defined population in this process, so it may be that site's not necessary at this moment in time for the booster shots. A reminder, if you're immunocompromised, to please reach out to your physician. You may already be eligible for a third shot, not a booster, a third shot, so please do that. But today we're here for a reason, because we're very proud. One of our stimulus initiatives that Legislator Abbott Keenan was a huge supporter of at the Health Committee was looking at all the impacts of COVID. And when we talked about this program, we were out in Cicero, North Syracuse. And certainly you can't talk about COVID and not talk about mental health. And you can't talk about mental health without talking about our young people and what they just went through over the last 2 years, 2 school years, now actually even going into a 3rd school year. So we came up and built on an infrastructure with our partners to deliver mental health services to every school district in Onondaga County. And we're here today to talk about that as the school starts. So as a reminder, what we're talking about is a 3-tiered mental health and service approach. And I want to acknowledge our partner, CCSI, and I know Jenny Dombrowski is here. And Jenny and their team have added 42 student assistant specialists to help do this. So we now have 75 student assistant specialists programmed in the districts to provide levels of support for the districts. We have access liaisons here in our second triangle. We've added 8 access liaisons. We now have 28 to enhance all districts' engagement and support with families. When we identify a challenge first, then we look to have support with families. And what we're really talking about is the top tier, the students who are most in need of help, the students who are in crisis, and providing the mental health clinics right here in the buildings. We're adding 21 licensed clinicians in our schools, giving us a total of 60 across all our districts. This service is in partnership with Upstate, St. Joseph's, Arise, Liberty Resources, and Helio Health. When you think about why, right, we want to keep the kids who are in crisis in this place in a safe space. And certainly these districts and these teachers and these professionals and these school buildings are that safe place and space for many of our young people. So having these services on site is critical to continue to do that. So we're very, very happy to be here. We're happy that we've gotten this rolled out. It really was a massive undertaking. We talked about it at the end of the last school semester. Here we are in the beginning. Every district, with the exception of one, I believe, has fully brought in this level of service to there. So at this time, I wanted to bring up Michelle Brantner, our superintendent from Marcellus, just to give you a little bit of perspective, and Kara Lux, the director of special education, a little bit of perspective on what this does for our district here. Okay.
Thank you, Ryan. On behalf of the Marcellus School District, and I dare say on behalf of all the school districts in Onondaga County, I think that I must speak for them in saying that this is a groundbreaking initiative, one that definitely is well needed in school districts across the state and across the nation. As Ryan mentioned, certainly this is where students are every day, so it makes sense to increase point of service here. As an educator myself for over 32 years now, it has long been a challenge for families to determine how to access services and for school districts to provide sufficient support for students that enter our doors with needs. So we're thrilled to be able to have this increased level of service, and I felt it important that Kara Lux, who is our Director of Special Education and Grants, she has really spearheaded connecting with Jenny Dombrowski and making this partnership happen. So I wanted her to be able to say a few words today as well. Kara?
Thanks, Michelle. First of all, again, thank you to Ryan McMahon for all of the supports that he's given to our district. It's just been incredible. We have, in the tiers of support, the student engagement specialist. We have one full-time student engagement specialist who's right now at Driver Middle School and really already making an impact with building those relationships with the students, with the staff, and we're so very, very grateful to have him here with us. We're also going to have a part-time access liaison who will service all of the schools across the district. And we're going to have 1.5 counselors, again, partnering with the county and Helio Health, 1.5 full-time counselors here for our students to be able to have access. So, again, thank you so much for all that you've done, and thank you so much to Jenny Dombrowski and all of her team as well.
Thanks, everybody. What's nice about this is we know we have this service, and this is about recovering, but at the same time, these investments are creating jobs, and so folks are getting back to work at the same time. Saying that, happy to take questions. Certainly, anyone else up here with me can answer questions as well. Yeah, I think right now we're over 75 jobs. As we expand it, the money can go further. Like everything right now, you're having a hard time hiring. We think maybe that's starting to get a little bit better with the enhanced unemployment benefits expiring. But to give an example, sometimes I hear at the legislature, sometimes I hear like feedback, what some of the legislators are saying, and I'm used to that. But we have 210 openings in county government today, right, that we can't fill today. And so we're like any organization that's trying to get back to full staff. This is in addition to that, and this will continue to expand. Other question? I believe that Fayetteville Manlius School District has not taken advantage of the mental health clinic at this point. I think they do offer some supports. We think this level of support is needed at every district. Kids are kids. It doesn't matter your backgrounds. What they all just went through is something they'll never forget. And so we've sent some information to clarify the services for the team, so they still have the opportunity to opt into the program if they want. Yeah, and I'll let Michelle and her team answer how it impacts Marcellus. But what we've seen, in addition to, unfortunately, drastic rates of increased suicide attempts, and what we've seen related to 911 calls doubling year over year for mental health incidents, this opioid crisis on fire again. So we know that there's crisis. What this is going to actually do is probably reveal how bad it is, right? So we actually have people who are directly engaging with kids and asking them, how are you? Are you okay? And I think we're going to be stunned to see how many people aren't okay, right? And so it's needed. This is about recovering and healing, and it's going to be a lot of work in the short term, but this is a model that is going to be here for as long as we have this leadership. But Michelle, maybe you want to talk about it here in Marcellus.
So I think first and foremost, we have to clarify that this is a program that's sort of at its inception stages, so maybe the impact will continue to reveal itself. But I would focus everyone on maybe the difference between an impact of quantity and an impact of quality. So for us in schools, if there's a child that's hurting and could go on to do something that might harm him or herself, as long as one child is helped, I'll be thrilled. We have an amazing counseling team here in the district as it is, school counselors at our middle and high school. We also have school social workers, and we also have school psychologists. And to say that with that level of service, they're overwhelmed trying to meet the need. This is such a a welcome addition. And I think as folks come on to that team, and really that's how we see it, we're adding the folks from this model into our overall team. I think that they will continue to find a niche and provide support for additional students that maybe are underserved at this point, or that we don't even know need service yet. So hopefully that gives you a little bit of a context.
Other questions? Really? Okay, yeah. So, not yet. That's not to suggest tomorrow we know is going to be a big case day. So I haven't seen, the state typically reports out and doing a system of cases. We then take those cases and qualify one if they're our residents or do they just get tested in our community and then transfer. And then you begin your case investigation work, and that's ongoing. Certainly, Fridays and Saturdays are always cases in the 200s under the current layout. So I expect that to be the case tomorrow and then on Saturday. And then we'll know more about what the cases are, and that gives us an idea of where things are. The trend this week, Glenn, has been that community spread is going down, but we've absorbed higher education cases as kind of the new category. And again, if you look at today's numbers, household contacts, 26%. That's been between 26 and 35% with the Delta variant. Again, there's nothing you can do to mitigate that. It's somebody in your house who gets it because you had it. And then higher ed's kind of most of the higher ed cases, sure, the kids they are mobile throughout the community, but most of that is driven by congregate settings, and that's 30%, right? And then you got travel at 7%. So you're looking at 63% of your cases that we can identify to specific areas, which gives us good data. The rest essentially community spread. That number, community spread, was a lot higher 3-4 weeks ago. So it looks like we're getting some good news. We're absorbing higher ed cases without our case count really going higher. And if the CDC projections are right, it looks like we're going to be flattening out for the next 2-3 weeks. And then hopefully, as a community, we can get this thing to curve and start to go down again. Other questions?
I'm a mother of 5 boys. I served as vice president of the Skaneateles School Board. And I can tell you long before the COVID situation, there's an issue in finding mental health care for children. I had lost one of my children, and it was good luck trying to find counselors for my 3 babies at the time who really needed help. You get put on a list. Anybody who's done this as a mom or father, grandparent, whoever you are, you know what it's like. There are 5- and 6-month wait lists out there. Yet the need is real, and it's now. And I'm really, really proud. We have a partner in Ryan McMahon because he cares about it. He's a dad. He gets it, and he listens. And the same with our superintendents and our school leaders. I mean, we really do care. And I know people get, a lot of flack over, masking, not masking. Parents are frustrated. Everybody's frustrated. But these people get in these careers because they care. And this is critical. The kids are here. We want them here. When you have a kid who is teetering on the edge, you want them with their peers. You want routine and trusted adults they can talk to. Anybody have a teen? Do they always want to talk to mom or dad? No. But if you can get a counselor or a critical person in their lives that they trust, that can make a difference, and you can save a child.
Yeah. No, so we've used stimulus funding to seed the program, and some of the school districts are actually participating in the cost as well. And then we have every intention to just put it into our budget moving forward. We've allocated $5.5 million to the initiative. I think the annual costs end up being a little less than that, Tom, but that's what we have earmarked for it, so it can go up to that. Other questions? It's a nice day. Enjoy it. Thanks, guys.